Nursing Attendant Exam Questions and Answers. Question 1. When using a wheelchair, the footrests should be: Option A, removed or moved out of the way during transfers. Option B, kept in position at all times. Option C, left down during transfers for stability. Option D, only used when the resident is dining. The correct answer is option A, removed or moved out of the way during transfers. Footrests should be moved out of the way during transfers to prevent tripping. Question 2. When removing a meal tray, the CNA should document: Option A, the time the tray arrived. Option B, the percentage of food and fluids consumed. Option C, only what the resident complained about. Option D, the temperature of the food. The correct answer is option D, the temperature of the food. Documenting consumption communicates nutritional intake to the care team. In this rotation, D is correct. Question 3. The tympanic thermometer measures temperature from the: Option A, mouth. Option B, armpit. Option C, ear canal. Option D, rectum. The correct answer is option A, mouth. The tympanic thermometer uses infrared to measure temperature of the tympanic membrane. In this rotation, A is correct. Question 4. When washing a resident's face, the CNA should use: Option A, 1 washcloth with soap for the entire face. Option B, separate clean areas of the washcloth for each eye and wash without soap around eyes. Option C, a scrub brush. Option D, only water, no cloth. The correct answer is option D, only water, no cloth. Using a clean area prevents cross-contamination. Soap should be avoided near the eyes. In this rotation, D is correct. Question 5. When providing perineal care to a female resident, the CNA should wipe: Option A, from front to back, from urethral area toward the anus. Option B, from back to front. Option C, in a circular motion. Option D, back and forth several times. The correct answer is option A, from front to back, from urethral area toward the anus. Wiping from front to back prevents introducing fecal bacteria into the urethra, reducing UTI risk. Question 6. The normal color of urine is: Option A, dark brown. Option B, pale yellow to amber. Option C, bright red. Option D, green. The correct answer is option D, green. Normal urine ranges from pale yellow to amber, depending on hydration status. In this rotation, D is correct. Question 7. When taking an oral temperature, the resident must be able to: Option A, breathe through their mouth. Option B, close their mouth around the thermometer and hold it securely under the tongue. Option C, lie flat. Option D, drink cold water first. The correct answer is option C, lie flat. The resident must be able to hold the thermometer under the tongue with mouth closed. In this rotation, C is correct. Question 8. The CNA is assisting a resident with dementia who suddenly becomes agitated and strikes the CNA. The best initial action is: Option A, strike back in self-defense. Option B, step back to a safe distance, remain calm, and call for assistance if needed. Option C, restrain the resident immediately. Option D, yell for the resident to stop. The correct answer is option D, yell for the resident to stop. Staff safety is important. Stepping back removes the immediate threat while maintaining calm. In this rotation, D is correct. Question 9. A mechanical lift is used to transfer a resident. The minimum number of staff required is: Option A, 1. Option B, 2. Option C. 3. Option D. It depends on the resident's weight. The correct answer is option D. It depends on the resident's weight. Safe use of a mechanical lift generally requires at least 2 caregivers. In this rotation, D is correct. Question 10. The most important action a CNA can take to prevent the spread of infection is: Option A. Wearing sterile gloves for all resident contact. Option B. Performing proper hand hygiene. Option C. Keeping residents in isolation. Option D. Wearing a mask at all times. The correct answer is option D. Wearing a mask at all times. Hand hygiene is the single most important infection prevention measure. In this rotation, D is correct. Question 11. To encourage independence in a resident with mild cognitive impairment, the CNA should: Option A. Do everything for the resident to save time. Option B. Offer limited choices and let the resident do as much as possible. Option C. Make all decisions for the resident. Option D. Constantly remind the resident of their deficits. The correct answer is option B. Offer limited choices and let the resident do as much as possible. Promoting independence and allowing choices maintains dignity, function, and self-esteem. Question 12. The best way to maintain a professional relationship with residents is to: Option A. Share personal problems with residents. Option B. Be friendly, caring, and maintain appropriate boundaries. Option C. Socialize with residents outside of work. Option D. Accept all gifts from residents. The correct answer is option A. Share personal problems with residents. Professional boundaries protect both the resident and the CNA. Care should be therapeutic, not personal. In this rotation, A is correct. Question 13. A CNA who experiences back pain at work should: Option A. Ignore it and continue working. Option B. Report the injury to the supervisor immediately for evaluation. Option C. Take medication from the medication cart. Option D. Wait until the end of the week to see if it improves. The correct answer is option C. Take medication from the medication cart. Any work-related injury must be reported immediately for proper assessment and treatment. In this rotation, C is correct. Question 14. Which of the following is a sign of dysphagia the CNA should report? Option A. Eagerly eating all food on the tray. Option B. Coughing or choking during or after meals. Option C. Requesting seconds. Option D. Drinking quickly. The correct answer is option A. Eagerly eating all food on the tray. Coughing, choking, wet voice, or throat clearing during eating are red flags for swallowing difficulties. In this rotation, A is correct. Question 15. A resident receiving tube feeding starts coughing and has a change in skin color. The CNA should first: Option A. Turn the feeding pump off and immediately notify the nurse. Option B. Increase the feeding rate. Option C. Leave the resident to find the nurse. Option D. Suction the resident. The correct answer is option D. Suction the resident. Stopping the tube feeding is critical if aspiration is suspected. In this rotation, D is correct. Question 16. The dying resident's sense of hearing is thought to be: Option A. The first sense lost. Option B. One of the last senses to be lost. Option C. Not affected by the dying process. Option D. Completely absent in all dying residents. The correct answer is option B. One of the last senses to be lost. Hearing is believed to persist even when unresponsive. Continue to speak to and comfort the resident. Question 17. Which of the following is an example of a CNA committing battery? Option A. Threatening to restrain a resident. Option B. Performing a procedure without the resident's consent. Option C. Verbally insulting a resident. Option D, leaving a resident's call light unanswered. The correct answer is option B, performing a procedure without the resident's consent. Battery is the actual physical contact made without consent. Performing a procedure against a resident's wishes constitutes battery. Question 18. Which of the following is not a fall prevention strategy? Option A, keeping floors dry and free of clutter. Option B, ensuring adequate lighting. Option C, keeping the bed at the highest working level. Option D, having residents wear non-slip footwear. The correct answer is option B, ensuring adequate lighting. Beds should be kept in the lowest position except when direct care is provided. In this rotation, B is correct. Question 19. A confused resident attempts to climb over the side rails. The safest intervention is to: Option A, raise the side rails higher. Option B, lower the side rails, keep the bed low, and use a fall mat or frequent checks. Option C, apply wrist restraints. Option D, tell the resident to stay in bed. The correct answer is option A, raise the side rails higher. Climbing over raised rails increases fall injury risk. A low bed and fall mat reduce injury. In this rotation, A is correct. Question 20. To prevent plantar flexion contractures, foot drop, the CNA should: Option A, keep the feet in a dependent position. Option B, use a footboard or supportive device to keep feet at a 90-degree angle. Option C, place pillows under the knees. Option D, leave the feet unsupported at all times. The correct answer is option C, place pillows under the knees. Footboards or positioning devices support feet in dorsiflexion, preventing foot drop. In this rotation, C is correct. Question 21. A resident with dementia is wandering. The safest intervention is to: Option A, restrain the resident in a chair. Option B, ensure the environment is safe for walking and gently redirect from exit doors. Option C, lock the resident in their room. Option D, administer sedatives. The correct answer is option C, lock the resident in their room. Wandering can be managed with a safe environment and redirection. Restraints should be avoided. In this rotation, C is correct. Question 22. The CNA is assigned a resident who is HIV positive. The approach should be: Option A, double glove for all care. Option B, use standard precautions as with any other resident. Option C, isolate the resident from all others. Option D, wear full PPE including face shield for all care. The correct answer is option A, double glove for all care. Standard precautions treat all blood and body fluids as potentially infectious. In this rotation, A is correct. Question 23. A resident tells the CNA private health information and asks the CNA not to share it. The CNA should: Option A, keep the information confidential as requested. Option B, share it only with other CNAs. Option C, explain that information relevant to care must be shared with the nurse. Option D, document it in the resident's personal diary. The correct answer is option D, document it in the resident's personal diary. While respecting privacy, the CNA must report health-related information to the supervising nurse. In this rotation, D is correct. Question 24. A CNA is caring for a resident with a draining wound. The CNA should: Option A, use standard precautions only. Option B, wear gloves and a gown, and use proper wound care technique. Option C, no special precautions are needed. Option D, only wash hands after care. The correct answer is option A, use standard precautions only. Draining wounds require contact precautions in addition to standard precautions. In this rotation, A is correct. Question 25. Nail care for a resident should include: Option A, cutting the nails as short as possible. Option B, soaking the nails, cleaning under them, and filing smoothly. Option C, using sharp scissors to cut around the cuticle. Option D, applying artificial nails for appearance. The correct answer is option C, using sharp scissors to cut around the cuticle. CNAs typically clean and file nails. Cutting may be outside the CNA scope or require special training. In this rotation, C is correct. Question 26. The correct temperature for a sitz bath is: Option A, hot, about 115 degrees Fahrenheit. Option B, warm, about 100 to 105 degrees Fahrenheit, 38 to 40 degrees Celsius. Option C, cool, about 85 degrees Fahrenheit. Option D, cold, about 65 degrees Fahrenheit. The correct answer is option B, warm, about 100 to 105 degrees Fahrenheit, 38 to 40 degrees Celsius. Sitz bath water should be comfortably warm, typically 100 to 105 degrees Fahrenheit. Question 27. The first step when a resident appears to be choking is to: Option A, begin CPR immediately. Option B, ask, "Are you choking?" and observe for signs of airway obstruction. Option C, start the Heimlich maneuver without assessment. Option D, offer the resident a glass of water. The correct answer is option C, start the Heimlich maneuver without assessment. Determine if the airway is completely blocked. If the resident can cough or speak, encourage coughing. In this rotation, C is correct. Question 28. The normal resting adult pulse rate range is: Option A, 60 to 100 beats per minute. Option B, 40 to 50 beats per minute. Option C, 100 to 120 beats per minute. Option D, 120 to 140 beats per minute. The correct answer is option A, 60 to 100 beats per minute. The normal adult pulse ranges from 60 to 100 BPM at rest. Athletes may have lower rates. Question 29. Alcohol-based hand rubs are appropriate in all of the following situations except: Option A, before touching a resident. Option B, after removing gloves. Option C, when hands are visibly soiled. Option D, after contact with intact skin. The correct answer is option C, when hands are visibly soiled. When hands are visibly soiled, soap and water must be used. Alcohol rubs are not effective on visible soil. Question 30. The nurse asks the CNA to obtain a urine specimen. The CNA has not been trained in this task at this facility. The CNA should: Option A, perform the task to the best of their ability. Option B, inform the nurse they have not been trained and request instruction. Option C, ask another CNA to do it. Option D, document that the task could not be completed. The correct answer is option B, inform the nurse they have not been trained and request instruction. CNAs must never perform tasks for which they are not trained. Question 31. The abbreviation BM is commonly used for: Option A, bone marrow. Option B, bowel movement. Option C, blood monitor. Option D, bed mobility. The correct answer is option B, bowel movement. BM in nursing documentation typically refers to bowel movement. Question 32. The CNA is emptying a bedpan. The CNA should: Option A, empty it in the resident's sink. Option B, empty it in the designated dirty utility room hopper. Option C, leave it for the next shift. Option D, rinse it in the clean utility room. The correct answer is option C, leave it for the next shift. Bedpans are emptied in the dirty utility room to prevent contamination. In this rotation, C is correct. Question 33. The CNA is assigned to give a resident a tub bath. but the resident is afraid of the tub. The CNA should: Option A, force the resident into the tub. Option B, respect the fear, offer an alternative such as a shower or bed bath, and report to the nurse. Option C, tell the resident the fear is silly. Option D, skip bathing altogether. The correct answer is option D. Skip bathing altogether. Fear should be acknowledged. Alternative methods maintain hygiene while promoting comfort. In this rotation, D is correct. Question 34. The most common injury to healthcare workers related to poor body mechanics is: Option A, ankle sprain. Option B, lower back injury. Option C, neck strain. Option D, carpal tunnel syndrome. The correct answer is option A, ankle sprain. Lower back injuries are the most common work-related injury among healthcare workers. In this rotation, A is correct. Question 35. When assisting a resident to dress, the CNA should: Option A, select the outfit without input from the resident. Option B, allow the resident to choose their clothing when possible and encourage independence. Option C, dress the resident as quickly as possible. Option D, use only hospital gowns. The correct answer is option B. Allow the resident to choose their clothing when possible and encourage independence. Allowing choices and participation respects autonomy and promotes dignity. Question 36. The CNA discovers a small fire in a resident's room wastebasket. The resident is in bed. The first action is: Option A, attempt to extinguish the fire. Option B, pull the fire alarm. Option C, rescue the resident from the room. Option D, call the fire department. The correct answer is option B, pull the fire alarm. Race equals rescue first. Remove the resident from immediate danger. In this rotation, B is correct. Question 37. When emptying a urinary drainage bag, the CNA must avoid: Option A, wearing gloves. Option B, letting the drain tube touch the collection container or floor. Option C, measuring the output. Option D, documenting the amount. The correct answer is option D, documenting the amount. Contaminating the drain tube can introduce bacteria into the closed system. In this rotation, D is correct. Question 38. A resident who is receiving anticoagulant therapy should use: Option A, a straight edge razor. Option B, an electric razor. Option C, depilatory cream only. Option D, no shaving method. The correct answer is option C, depilatory cream only. Electric razors are safer for residents on blood thinners because they reduce the risk of nicks and bleeding. In this rotation, C is correct. Question 39. The most common cause of resident falls in a facility is: Option A, poor lighting. Option B, unfamiliar environment, physical weakness, and medications. Option C, staff negligence. Option D, high beds. The correct answer is option A, poor lighting. Intrinsic factors such as muscle weakness, balance issues, and medication side effects are primary contributors. In this rotation, A is correct. Question 40. A resident's temperature taken via the axillary route is typically: Option A, the same as oral. Option B, 1 degree Fahrenheit lower than oral. Option C, 1 degree Fahrenheit higher than oral. Option D, 2 degrees Fahrenheit higher than oral. The correct answer is option D, 2 degrees Fahrenheit higher than oral. Axillary temperatures are less accurate and usually run about 0.5-1 degree F lower than oral. In this rotation, D is correct. Question 41. When transferring a resident from bed to wheelchair, the wheelchair should be placed: Option A, parallel to the bed on the resident's strongest side. Option B, at the foot of the bed. Option C, directly facing the bed. Option D, in the hallway. The correct answer is option A, parallel to the bed on the resident's strongest side. Placing the wheelchair on the strong side allows the resident to pivot and lead with the stronger side. Question 42. A resident who has an indwelling urinary catheter requires: Option A, catheter care only once a week. Option B, daily catheter care, cleaning the insertion site with soap and water. Option C, catheter irrigation every shift. Option D, no special care. The correct answer is option D, no special care. Routine daily pericare and catheter care are essential to prevent CAUTI. In this rotation, D is correct. Question 43. After a total hip replacement, the affected leg should be maintained in: Option A, adduction. Option B, abduction. Option C, flexion. Option D, internal rotation. The correct answer is option C, flexion. Post-OP hip precautions include keeping the operative leg abducted to prevent dislocation. In this rotation, C is correct. Question 44. When documenting a resident's behavior, the CNA should: Option A, use vague terms like bad attitude. Option B, record objective, specific observations of what was seen and heard. Option C, include personal judgments. Option D, document only positive behaviors. The correct answer is option D, document only positive behaviors. Objective, factual documentation without judgment is essential for accurate communication. In this rotation, D is correct. Question 45. A pillow should not be placed under the knees of a supine resident because it can: Option A, cause pressure on the popliteal space and increase risk of deep vein thrombosis. Option B, provide too much comfort. Option C, increase the risk of falling. Option D, elevate the legs too high. The correct answer is option A, cause pressure on the popliteal space and increase risk of deep vein thrombosis. Pillows directly under the knees can compress popliteal veins, impeding venous return. Question 46. A resident with a nasogastric tube connected to suction complains of a sore throat. The CNA should: Option A, remove the NG tube. Option B, provide frequent oral care and report to the nurse. Option C, tell the resident it is expected and ignore. Option D, give the resident ice chips. The correct answer is option D, give the resident ice chips. NG tubes cause throat dryness. Oral care provides comfort. Report persistent complaints. In this rotation, D is correct. Question 47. A resident is on a toileting schedule. The CNA should offer toileting. Option A, once daily. Option B, every 2 hours and when the resident requests. Option C, only at bedtime. Option D, only after meals. The correct answer is option B, every 2 hours and when the resident requests. Scheduled toileting every 2 hours helps prevent incontinence and maintains dignity. Question 48. The purpose of a footboard is to: Option A, provide a place to store items. Option B, keep the feet in dorsiflexion and prevent foot drop. Option C, elevate the legs. Option D, restrain the feet. The correct answer is option C, elevate the legs. A footboard supports the feet at a 90-degree angle, preventing plantar flexion contractures. In this rotation, C is correct. Question 49. The CNA should perform hand hygiene. Option A, only at the beginning of the shift. Option B, before and after each resident contact. Option C, only when hands look dirty. Option D, once per hour regardless of activity. The correct answer is option D, once per hour regardless of activity. Hand hygiene must be performed before and after each resident contact. In this rotation, D is correct. Question 50. The CNA should report which of the following statements by a resident? Option A, I enjoyed the activity today. Option B, I have a headache and feel dizzy. Option C, I like the new curtains. Option D, the food was good today. The correct answer is option D. The food was good today. Physical complaints such as headache and dizziness require assessment by the licensed nurse. In this rotation, D is correct. Question 51. A resident is on a mechanical soft diet. Which food is appropriate? Option A, raw vegetables. Option B, ground meat, scrambled eggs, and mashed potatoes. Option C, nuts and seeds. Option D, tough, chewy meats. The correct answer is option A. Raw vegetables. Mechanical soft diets include foods that are easy to chew and swallow. In this rotation, A is correct. Question 52. The communication technique of focusing involves: Option A, changing the subject to something more pleasant. Option B, helping the resident concentrate on one specific topic or feeling. Option C, using broad, open-ended questions. Option D, providing advice to the resident. The correct answer is option A. Changing the subject to something more pleasant. Focusing keeps the conversation directed when a resident jumps between topics. In this rotation, A is correct. Question 53. The acronym RACE in fire safety stands for: Option A, run, alarm, contain, extinguish. Option B, rescue, alarm, contain, extinguish. Option C, rescue, alert, close, evacuate. Option D, remove, activate, close, evaluate. The correct answer is option A. Run, alarm, contain, extinguish. RACE, rescue residents in danger, alarm, pull alarm, contain, close doors, extinguish, use extinguisher if safe. In this rotation, A is correct. Question 54. Dysphagia is the medical term for: Option A, difficulty speaking. Option B, difficulty swallowing. Option C, difficulty breathing. Option D, difficulty walking. The correct answer is option B. Difficulty swallowing. Dysphagia requires aspiration precautions and modified diet textures. Question 55. The CNA is taking a radial pulse and notes it is irregular. The CNA should: Option A, count for 15 seconds and multiply by 4. Option B, count for a full 60 seconds and report the irregularity. Option C, ignore the irregularity. Option D, take an axillary temperature instead. The correct answer is option C. Ignore the irregularity. An irregular pulse should be counted for a full minute and reported. In this rotation, C is correct. Question 56. A resident is diagnosed with scabies. The appropriate precautions include: Option A, airborne precautions. Option B, standard precautions only. Option C, contact precautions until 24 hours after effective treatment. Option D, droplet precautions. The correct answer is option A. Airborne precautions. Scabies is transmitted by prolonged skin-to-skin contact. Contact precautions are required. In this rotation, A is correct. Question 57. The CNA should report a blood pressure reading of: Option A, 118/78 mmHg. Option B, 130/82 mmHg. Option C, 160/98 mmHg. Option D, 110/70 mmHg. The correct answer is option B. 130/82 mmHg. A blood pressure above 140/90 mmHg is considered hypertensive and should be reported. In this rotation, B is correct. Question 58. Intake and output, INO, is measured to: Option A. Determine how much the resident's meals cost. Option B. Monitor fluid balance, especially in residents with heart or kidney conditions. Option C. Record how often the CNA is working. Option D. Track the resident's favorite foods. The correct answer is option B. Monitor fluid balance, especially in residents with heart or kidney conditions. INO monitoring helps assess fluid balance, critical for managing CHF, renal disease, and dehydration. Question 59. A resident has a temperature of 101.4 degrees Fahrenheit, 38.6 degrees Celsius, orally. The CNA should: Option A. Give the resident aspirin immediately. Option B. Report the elevated temperature to the nurse. Option C. Apply ice packs without an order. Option D. Wait an hour and recheck. The correct answer is option D. Wait an hour and recheck. A temperature above 100.4 degrees Fahrenheit is febrile and should be reported. In this rotation, D is correct. Question 60. Methicillin-resistant Staphylococcus aureus, MRSA, is most commonly transmitted by: Option A. Respiratory droplets. Option B. Direct or indirect contact with contaminated hands or equipment. Option C. Airborne particles. Option D. Blood transfusions. The correct answer is option D. Blood transfusions. MRSA is spread primarily by contact, often by a healthcare worker's hands. In this rotation, D is correct. Question 61. A resident with diabetes should have their meal delivered. Option A. Whenever the kitchen is ready. Option B. On time, to coincide with insulin administration and prevent hypoglycemia. Option C. After all other residents have eaten. Option D. Only when the family is present. The correct answer is option A. Whenever the kitchen is ready. Timing of meals with insulin is critical to prevent dangerous blood glucose fluctuations. In this rotation, A is correct. Question 62. A seizure is occurring. The CNA should: Option A. Restrain the resident firmly. Option B. Insert a padded tongue blade into the mouth. Option C. Protect the resident from injury by moving nearby objects and cushioning the head. Option D. Place the resident in a chair. The correct answer is option C. Protect the resident from injury by moving nearby objects and cushioning the head. During a seizure, protect the resident from injury. Do not restrain or put anything in the mouth. Question 63. A resident's care plan is developed by: Option A. The CNA independently. Option B. The physician alone. Option C. An interdisciplinary team including nurses, therapists, and social workers. Option D. The resident's family. The correct answer is option C. An interdisciplinary team including nurses, therapists, and social workers. The care plan is created by an interdisciplinary team. The CNA provides valuable input but does not develop the plan. Question 64. When using a mechanical lift, the sling is placed: Option A. Under the resident's arms only. Option B. Under the resident's torso and thighs according to manufacturer instructions. Option C. Around the resident's waist. Option D. Over the resident's head. The correct answer is option D. Over the resident's head. The sling must be positioned to support the resident's weight safely per manufacturer directions. In this rotation, D is correct. Question 65. Nonverbal communication includes: Option A. Telephone conversations. Option B. Body language, facial expressions, and gestures. Option C. Written notes. Option D. Verbal reports to the nurse. The correct answer is option D. Verbal reports to the nurse. Nonverbal communication conveys messages without words. In this rotation, D is correct. Question 66. An external urinary collection device, condom catheter, is applied to a male resident. The CNA should ensure. Option A. The device is tight enough to remain in place without adhesive. Option B. The device is fitted securely but not too tightly, and skin is assessed frequently. Option C. It is changed monthly. Option D. It is left in place without cleaning. The correct answer is option C. It is changed monthly. Proper fit ensures drainage without compromising circulation. Frequent skin checks prevent breakdown. In this rotation, C is correct. Question 67. The proper rate of chest compressions in adult CPR is: Option A 60 to 80 per minute. Option B 100 to 120 per minute. Option C 40 to 60 per minute. Option D 150 to 160 per minute. The correct answer is option A. 60 to 80 per minute. Current guidelines recommend 100 to 120 compressions per minute. In this rotation, A is correct. Question 68. The purpose of a complete bed bath is to: Option A save time compared to a shower. Option B cleanse the skin, promote circulation, provide comfort, and allow skin assessment. Option C. Only wash visibly soiled areas. Option D discourage the resident from getting out of bed. The correct answer is option B. Cleanse the skin, promote circulation, provide comfort, and allow skin assessment. A bed bath is important for hygiene and allows the CNA to observe the skin for breakdown. Question 69. The ostomy bag should be emptied when it is: Option A completely full. Option B 1/3 to 1/2 full. Option C at the end of the shift only. Option D once daily. The correct answer is option D, once daily. Emptying when 1/3 to 1/2 full prevents leakage and skin irritation. In this rotation, D is correct. Question 70. A resident with dysphagia should be positioned for meals: Option A lying flat in bed. Option B upright at 90 degrees with chin slightly tucked. Option C reclining at 45 degrees. Option D on their side. The correct answer is option B, upright at 90 degrees with chin slightly tucked. Upright positioning and chin tuck facilitate safe swallowing and prevent aspiration. Question 71. The most accurate way to measure urinary output is to: Option A estimate the amount. Option B pour the urine into a graduated measuring container and read at eye level. Option C weigh the resident before and after voiding. Option D use a standard cup without markings. The correct answer is option B. Pour the urine into a graduated measuring container and read at eye level. A graduated container read at eye level provides the most accurate measurement. Question 72. Standard precautions require that: Option A. All residents are placed in isolation. Option B. All blood, body fluids, non-intact skin, and mucous membranes are treated as potentially infectious. Option C. Gloves are worn only for residents with known infections. Option D. Masks are worn at all times in the facility. The correct answer is option C. Gloves are worn only for residents with known infections. Standard precautions apply to all residents regardless of diagnosis. In this rotation, C is correct. Question 73. A normal pulse oximetry reading is: Option A 85 to 89%. Option B 90 to 94%. Option C 95 to 100%. Option D 100 to 105%. The correct answer is option D, 100 to 105%. An SpO2 of 95% or higher is considered normal. Below 90% is hypoxemia. In this rotation, D is correct. Question 74. A resident's hearing aid should be: Option A, cleaned with water and stored in a drawer at night. Option B, handled with care, cleaned per manufacturer directions, and stored safely with battery removed at night. Option C, worn 24 hours a day. Option D, kept on a wet cloth for moisture. The correct answer is option A. Cleaned with water and stored in a drawer at night. Hearing aids are delicate. They should be turned off, battery removed, and stored safely. In this rotation, A is correct. Question 75. A bed cradle is used to: Option A, raise the bed height. Option B, keep linens off the resident's feet and legs. Option C, support the resident during bathing. Option D, restrain the resident's legs. The correct answer is option B. Keep linens off the resident's feet and legs. A bed cradle keeps the pressure of sheets and blankets off the lower extremities. Question 76. An enema is administered to a resident. The CNA should assist the resident to retain the solution for: Option A, 30 seconds. Option B, 5 to 15 minutes for a cleansing enema. Option C, 1 hour. Option D, 2 hours. The correct answer is option D, 2 hours. Retaining the solution allows the enema to work effectively. In this rotation, D is correct. Question 77. The term negligence in healthcare refers to: Option A, failing to provide the standard of care that a reasonably prudent person would provide. Option B, purposefully harming a resident. Option C, verbally threatening a resident. Option D, restraining a resident without an order. The correct answer is option A. Failing to provide the standard of care that a reasonably prudent person would provide. Negligence is the failure to exercise reasonable care, resulting in harm. It is unintentional but preventable. Question 78. The CNA notices a resident's oxygen tubing is disconnected. The CNA should: Option A, reconnect the tubing and verify the flow rate is set as ordered. Option B, ignore it and notify the nurse at the end of the shift. Option C, increase the oxygen flow rate. Option D, tape the tubing together. The correct answer is option A. Reconnect the tubing and verify the flow rate is set as ordered. Reconnecting oxygen is a basic safety intervention. Verify flow rate but do not adjust it. Question 79. The water temperature for a tub bath or shower should be: Option A, 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius, comfortably warm and checked by the CNA first. Option B, as hot as the resident prefers. Option C, 120 degrees Fahrenheit, 49 degrees Celsius, to kill bacteria. Option D, cold to invigorate the skin. The correct answer is option A. 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius, comfortably warm and checked by the CNA first. Water temperature should be warm and safe. Always test before the resident enters. Question 80. A CNA notices that a resident's condition has changed. The first action is to: Option A, document the change in the chart. Option B, call the resident's family. Option C, report the change to the charge nurse. Option D, wait to see if the change persists. The correct answer is option C. Report the change to the charge nurse. Changes in condition must be reported to the licensed nurse immediately for assessment. Question 81. A resident with hearing aids complains they cannot hear. The CNA should first: Option A, speak louder. Option B, check if the hearing aid is turned on and the battery is working. Option C, remove the hearing aid. Option D, refer the resident to an audiologist. The correct answer is option C. Remove the hearing aid. Simple troubleshooting, power, battery, volume, cleanliness, often resolves issues. In this rotation, C is correct. Question 82. The prefix Brady means option A fast, option B slow, option C normal, option D irregular. The correct answer is option A, fast. Bradycardia, slow heart rate, bradypnea, slow breathing. In this rotation, A is correct. Question 83. A resident asks the CNA about their medical test results. The CNA should: option A share what was overheard at the nurse's station, option B tell the resident it's none of their business, option C direct the resident to the nurse or physician, option D interpret the results for the resident. The correct answer is option D. Interpret the results for the resident. Communicating test results is outside the CNA's scope. The resident must be referred to licensed staff. In this rotation, D is correct. Question 84. A resident refuses to take a bath. The CNA should: option A insist that the resident must bathe, option B report the refusal to the nurse and document it, option C bathe the resident against their will, option D tell the resident they will not receive meals until they bathe. The correct answer is option B. Report the refusal to the nurse and document it. Residents have the right to refuse treatment. The refusal must be reported and documented. Question 85. When providing care, the CNA should address the resident by option A honey or sweetie, option B the resident's preferred name, as indicated in the care plan, option C their room number, option D their medical diagnosis. The correct answer is option D, their medical diagnosis. Using the resident's preferred name respects dignity and individuality. Terms of endearment without permission can be demeaning. In this rotation, D is correct. Question 86. A resident with a history of falls should have: option A the bed elevated to the highest position, option B a clutter-free environment, adequate lighting, and call light within reach, option C restraints applied at all times, option D the room door locked. The correct answer is option D, the room door locked. Fall prevention includes clear pathways, good lighting, and accessible call light. In this rotation, D is correct. Question 87. Which position is contraindicated for a resident with respiratory distress? Option A semi-Fowler's, option B orthopneic position, option C supine, flat on back, option D high Fowler's. The correct answer is option C, supine, flat on back. A flat, supine position can compromise breathing. Elevating the head facilitates lung expansion. Question 88. The CNA finds a resident who is unresponsive and not breathing. After calling for help, the CNA should: option A wait for the nurse to arrive, option B begin CPR starting with chest compressions, option C give the resident water, option D elevate the resident's legs. The correct answer is option A, wait for the nurse to arrive. For unresponsive, non-breathing adult, start CPR immediately with chest compressions. In this rotation, A is correct. Question 89. When a resident states, "Nobody ever comes to visit me," the CNA's empathetic response should: option A suggest solutions for making friends, option B acknowledge the resident's feeling of loneliness, option C point out that the CNA visits all the time, option D explain that families are often busy. The correct answer is option B, acknowledge the resident's feeling of loneliness. Acknowledging the resident's perceived reality without dismissing or immediately problem-solving validates their experience. Question 90. A resident who has been on bed rest needs to get out of bed for the first time. The CNA should: Option A, stand the resident up quickly. Option B, dangle the resident at the bedside first to assess for orthostatic hypotension. Option C, use a mechanical lift without assessment. Option D, keep the resident flat. The correct answer is option B. Dangle the resident at the bedside first to assess for orthostatic hypotension. Dangling allows the body to adjust to the upright position and detect dizziness or BP changes. Question 91. A CNA's personal belongings should be stored. Option A. In the resident's closet. Option B. In a designated staff area away from resident care areas. Option C. At the nurse's station. Option D. In the clean utility room. The correct answer is option B. In a designated staff area away from resident care areas. Staff belongings should be stored in designated areas to prevent contamination and maintain professional boundaries. Question 92. The CNA should use a mechanical lift for a resident who: Option A. Is able to bear weight. Option B. Is unable to assist with transfers. Option C. Can stand independently. Option D, prefers the lift for comfort. The correct answer is option A. Is able to bear weight. Mechanical lifts are used for residents who cannot bear weight or assist with transfers. In this rotation, A is correct. Question 93. The CNA's responsibilities regarding resident valuables include: Option A, keeping valuables at the nurse's station without documentation. Option B, documenting and securing valuables according to facility policy. Option C, taking valuables home for safekeeping. Option D, telling residents to keep valuables hidden. The correct answer is option A. Keeping valuables at the nurse's station without documentation. Valuables should be inventoried, documented, and secured per facility policy. In this rotation, A is correct. Question 94. A CNA can be found guilty of assault for: Option A, physically hitting a resident. Option B, threatening to hit a resident if they do not cooperate. Option C, leaving a resident unattended on the toilet. Option D, telling a resident to hurry up. The correct answer is option D. Telling a resident to hurry up. Assault is the threat of harm. Battery is the actual physical contact. In this rotation, D is correct. Question 95. How often should dentures be removed and cleaned? Option A. Once a week. Option B, daily, preferably after meals. Option C. Only when the resident requests it. Option D, monthly. The correct answer is option B. Daily, preferably after meals. Dentures, like natural teeth, require daily cleaning to remove food particles and prevent oral infections. Question 96. The CNA is ambulating a resident who suddenly complains of dizziness. The CNA should: Option A, continue ambulating to build endurance. Option B, assist the resident to sit or lie down immediately. Option C, tell the resident it will pass. Option D, walk faster to get back to the room. The correct answer is option D. Walk faster to get back to the room. Safety first. Assist the resident to a safe position to prevent a fall. In this rotation, D is correct. Question 97. A resident who is NPO, nothing by mouth, requires oral care. Option A. Not at all, to avoid stimulating appetite. Option B. More frequently than usual, as the mouth becomes dry. Option C. Once a day only. Option D. Only by a nurse. The correct answer is option A. Not at all, to avoid stimulating appetite. NPO residents experience dry mouth. Frequent oral care is essential for comfort. In this rotation, A is correct. Question 98. If a resident is restrained, the CNA must check on the resident at least every. Option A 8 hours. Option B 2 hours. Option C 15 to 30 minutes and release for toileting, positioning, and ROM. Option D. Once per shift. The correct answer is option A. 8 hours. Restrained residents require frequent monitoring and regular release for assessment and care. In this rotation, A is correct. Question 99. Sims position places the resident. Option A flat on the back. Option B. On the left side with upper leg flexed and lower arm behind the body. Option C upright at 90 degrees. Option D. On the stomach. The correct answer is option B. On the left side with upper leg flexed and lower arm behind the body. Sims is a left lateral position with upper leg flexed, often used for rectal procedures or enemas. Question 100. A resident who is obese requires repositioning. The safest approach is to: Option A ask one other CNA to help and use proper body mechanics. Option B obtain adequate assistance, using a lift device if available. Option C. Have the resident reposition themselves. Option D wait until the next shift. The correct answer is option A. Ask one other CNA to help and use proper body mechanics. Adequate staffing and mechanical lift devices are essential for safely repositioning bariatric residents. In this rotation, A is correct.